Greetings from the team cardiology at Venkateshwar. I am Dr. Colonel Subroto Datta. I am the director of the cardiology program here, and I also happen to be an interventional cardiologist and an electrophysiologist. It's a privilege that on the World Heart Day I am able to communicate with you, and the part of the cardiac issues which I think should be in the social and public domain is that it can also be something which can be of concern for the young. The young should not feel that they are immune to cardiac illnesses. We have all seen these Euro Club clippings where a very trained and a very fit athlete, sportsman, footballer crashes on the field and with very adverse outcomes. So I would like to first tell you that what are the early signs which should red flag you and say that okay, I need some advice, some consultation, some change in my lifestyle. So the foremost is, do you have a family history of coronary artery disease or premature sudden death or diabetes or hypertension? So you can risk profile your genetics and your inheritance or your hereditary predisposition for disease. Second is to see whether the individual concerned has habits which are adverse, for example intake of tobacco, fatty oily meal, and a sedentary lifestyle. So these things also promote bad health and bad cardiovascular fitness. So we should be very aware that these can lead to illness. The signs which should warn us are if we find that our effort tolerance is reducing. We are panting when we are walking up briskly a flight of stairs to the metro station. We are gaining weight inappropriately. We are getting easily fatigued at the end of the day. We are exhausted. Another thing which often takes people by surprise, they expect that every time a person has a heart attack, he has severe chest pain. It's not necessarily so. Angina and ischemic pain can just be a heaviness which is all over the chest. It may radiate to the back, the stomach, the jaw, or the arms. So it can be quite varied. It need not be a pain. It can be a feeling of suffocation with sweating, giddiness, even vomiting. Other signs which should warn the young is if the person feels giddy repeatedly, has loss of consciousness or syncope. So these are the early warning signs which should make you seek professional advice. Now, what are the easy remedies to ensuring you remain healthy? Give some time for yourself. And if you can embrace and involve your other family members and friends, that's even better, because then your involvement in that activity will be longer. You'll enjoy it more. So it can be a game of tennis. It can be just going for a walk, cycling, go to a neighborhood park. On Sunday, take your family out and have a lunch, particularly in these autumn and winter months. It's a very good idea. Instead of sitting at home, just get up and go and have your lunch under it, in a park. So increasing outdoor activities, even small activities like kite flying in a park or playing some games together, it goes a long way to making you healthy. Ensure you take adequate amount of fluids, 2 to 3 liters. Every meal you have should have green and raw things in them with a lot of fiber. It can be salads, it can be oats, it can be dalia, it can be sprouts. So anything which is raw is extremely healthy for you. So replace oily, processed, salty and excessively sugary food with naturally sweet, natural food products, and that's the best thing you can do. And with this, I wish you all a very happy and healthy future ahead.